You know those stubborn light patches on your skin that never seem to tan no matter what? For some of us, well, it's more than just a minor annoyance.
It really is. And today, we're diving deep into a potential way to manage vitiligo, which is the condition marked by these very depigmented areas. It affects roughly 1 to 2% of people globally.
Yeah,
And beyond just the cosmetic side of things, it can, really impact someone's psychological well-being.
absolutely. And our mission today, really sparked by some fascinating research you shared with us, is to try and figure out if a particular antioxidant enzyme called superoxide dismutase, let's just call it SOD maybe,
SOD, yeah.
if SOD could actually be a helpful tool in addressing vitiligo. We've got a couple of studies that looked at it in, well, different ways.
That's right. So the first piece of research we're going to unpack looked at a topical gel. It contained SOD plus another enzyme called catalase.
Okay.
And this was used together with narrowband UVB phototherapy. Now, it's important to say right up front that this study was what we call open and uncontrolled.
Right. Open and uncontrolled. So what does that mean exactly in terms of the results?
Well, open means everyone knew who was getting the treatment. And uncontrolled means there wasn't a comparison group getting a placebo, like a dummy gel.
Ah,
So it makes it a bit harder to say definitively that the gel itself caused all the improvement.
Yeah.
The light therapy was also happening.
got it. So, okay, let's back up a bit. Why these two enzymes, SOD and catalase? What's the thinking behind using them for vitiligo?
Yeah, the rationale really comes down to the biochemistry involved in vitiligo. Some research has shown that people with vitiligo often have lower levels of catalase in their affected skin.
Lower catalase,
Right. And at the same time, they might have higher levels of hydrogen peroxide, H2O2.
which isn't good for pigment cells, I take it.
Exactly. Hydrogen peroxide can actually be harmful, damaging to the melanocytes. Those are the cells responsible for producing our skin pigment. So SOD and catalase, they kind of act like a cleanup crew. They help neutralize these damaging oxidation products. And in this specific gel, the SOD actually came from a plant source, Cucumis mellow, which is basically cantaloupe melon.
From cantaloupe. Okay, interesting. And who took part in this first study then? What kind of patients?
So there were 19 people involved. They had different types of vitiligo. Some had it quite widespread, what's called vulgaris, others more on the face and limbs, acrofacials, and some had just localized patches.
A real mix then.
Yeah, and a range of skin types, too. The average age was about 29, and they'd had vitiligo for around 6 years on average. It's also worth mentioning, some had tried other treatments before, like corticosteroids or PUVA therapy,
Right.
while others hadn't had any treatment prior to this study.
Okay. So you've got these diverse participants. How did they actually use this gel and the UVB light therapy combination in practice? What was the routine?
The protocol was apply the SOD and catalase gel twice a day, every day for 6 months straight.
6 months. Okay.
And alongside that, they went for narrowband UVB phototherapy sessions 3 times a week. The initial UVB dose started low and was then gradually increased.
Depending on how their skin reacted.
Exactly, based on each person's skin response. They were careful about eye protection during the UVB, of course.
Right. So 6 months of gel and light therapy. What were the main results? Did this combined approach seem to, make a difference?
The results were actually quite encouraging, especially given the study design limitations we mentioned. Overall, nearly 58%, so well over half of the participants saw more than 50% repigmentation by the end of the 6 months.
Wow. Okay. Over half seeing significant improvement.
Yeah. And for almost 16% of them, the repigmentation was considered excellent, meaning over 75% pigment return.
That's pretty substantial.
It is. And then about 31% had what they termed moderate repigmentation, so between 26% and 50%. Only a small number, about 10%, had poor or no repigmentation. So yeah, a good chunk of patients saw real improvement.
That does sound really promising. Did they notice if certain parts of the body responded better than others? Because that often happens with vitiligo treatments, right?
Absolutely. And they did see that here. The face and neck showed the best response by far.
Okay.
In fact, almost 79% of patients with patches in those areas got over 50% repigmentation, and over 35% had that excellent level of repigmentation.
That's impressive for the face and neck.
Yeah, and the study actually includes a picture. They label it Figure 1B, showing a woman's profile. You can see really noticeable, though maybe not totally complete, repigmentation on her cheek after the 6 months.
Ah, okay.
The upper arms, legs, and the trunk also did pretty well. Now, as you kind of hinted, the hands and feet were the most resistant. That's pretty typical for vitiligo.
Yeah, always tricky areas.
Always tricky. But even there, they saw some improvement. 15% had excellent results. There's another picture, figure 2, B showing a woman's hands from above, and you can see quite significant pigment returning on her fingers and the back of her hands.
So even the tough spots showed something. That's good news. Any downsides? Side effects? New patches?
Importantly, they didn't see any new vitiligo patches developing during the study period, and the side effects reported were generally mild things like some redness after the UVB, which is expected, or occasional stinging or itching from the gel for a few people. Nothing serious.
Okay, so overall, the researchers felt this combination was a potentially good option then.
They concluded that yes, this combination therapy could be considered a therapeutic option for managing vitiligo, but they were also quite clear, and rightly so, that we really need more rigorous, controlled studies to confirm these initial findings.
Because of that uncontrolled aspect we talked about earlier.
Exactly. They also noted something interesting. While the UVB light definitely played a big role, they thought it was possible the gel itself added some extra benefit. Even though, confusingly, there was apparently another report suggesting that this particular gel formulation might not actually reduce hydrogen peroxide levels in the way you'd expect.
It's a bit of a question mark there, maybe, about how it might be helping, if it is.
Precisely. Could it be another mechanism? Or maybe an issue with that other conflicting report? It leaves things a bit open-ended on the exact mechanism for the gel.
Okay, that gives us a really good picture of the topical approach study. Now, you mentioned a second study. How did that one differ?
Right. The second study took a completely different tack. It investigated taking SOD orally in capsule form. And this SOD was protected by something called gliadin.
Gliadin-protected SOD.
Okay, and again, it was combined with narrowband UVB. But this study was much more robust in its design. It was a 24-week, prospective, randomized, placebo-controlled trial.
Okay, placebo-controlled. That's the key difference there.
That's a big one, yeah. They specifically looked at people with non-segmental vitiligo, the more common, widespread type that affected more than 5% of their body surface.
And why the gliadin-protected part? What does that do for the SOD?
That's a really crucial detail. See, if you just swallow regular SOD, your digestive system, particularly stomach acid and enzymes, tends to break it down pretty effectively.
So it wouldn't get absorbed properly.
Exactly. It likely wouldn't reach the bloodstream or tissues in an active form. So by binding the SOD enzyme to gliadin, which is a protein found in wheat,
Or like gluten.
related to gluten, yeah, it forms a kind of protective biopolymer shield around the SOD. The idea is this shield helps it survive the journey through the stomach and intestines, allowing for better absorption.
Okay, that makes sense. Like an enteric coating, but using gliadin. And what was the rationale here for using oral SOD? Still targeting oxidative stress.
Yes. The underlying rationale is very similar to the first study. It focuses on oxidative stress. The thinking is that the stress isn't just involved in the initial destruction of melanocytes,
Right.
but it might also hinder the repigmentation process itself. So the hope was that by boosting the body's antioxidant defenses from the inside, using oral SOD, they could maybe reduce that stress systemically.
And potentially make the UVB therapy work better.
Precisely. Make the skin environment more receptive to the repigmentation stimulated by the light therapy.
Makes sense. Who were the participants in this oral SOD trial?
This one involved 50 adults, all with non-segmental vitiligo. And a key point here is that many of them were considered somewhat recalcitrant cases, meaning they hadn't responded well to previous treatments, and many had had vitiligo for a long time, so perhaps a tougher group to treat.
Right.
They were randomly assigned using a computer into one of two groups. One group got the gliadin-protected SOD, GPSOD, and the other got an identical-looking placebo capsule.
The dummy pill.
Exactly. And crucially, both groups received narrowband UVB therapy, but this time it was twice a week, not 3 times.
Okay, so randomized, placebo-controlled, but maybe a slightly less intensive UVB schedule.
Yeah.
And what was the dosing for the oral SOD?
The group getting the actual GPSOD took 1 gram per day, usually split into 2 doses for the first 12 weeks. Then, for the second 12 weeks, the dose was halved to 0.5 grams per day. The placebo group followed the exact same schedule with their inactive capsules, and everyone did the twice-weekly UVB for the full 24 weeks.
Right. So this more controlled study, what did it find? Did the oral SOD actually boost the effects of the UVB?
Well, this is where it gets interesting. They primarily looked at the overall improvement in vitiligo extent using a score called the VES Vitiligo Extent Score. Lower score means less vitiligo.
Okay.
And after 24 weeks, the group taking the GPSOD showed a significantly greater improvement in their VES score compared to the placebo group.
How significant?
The GPSOD group improved by almost 20% on average, whereas the placebo group improved by about 8.8%. And that difference was statistically significant, with a p-value less than 0.00001, which is quite strong.
Wow. Okay, so the oral SOD plus UVB did lead to more overall repigmentation than just UVB plus placebo.
That's what the VES score suggests, yes. However, there was a slight nuance. When they looked specifically at the rate of repigmentation, how quickly the pigment was returning, the difference between the two groups didn't quite reach statistical significance. The p-value there was 0.089.
So a significant difference in the final outcome score, but not quite in the speed of getting there. How does that work?
It's a subtle distinction. It might mean the SOD group perhaps continued improving steadily over the whole period, or had more people showing some improvement, leading to a better average final score, even if the week-to-week pace wasn't statistically faster than placebo, one averaged out. It suggests a benefit, but perhaps not a dramatically accelerated one.
Okay, I think I get that. What else did they look at? Did more people in the SOD group reach, say, a certain threshold of improvement?
Yes, they did look at that. And they found that more patients taking the GPSOD achieved at least 30% improvement in their VES score, and also more achieved at least 50% improvement compared to the placebo group. So, higher proportions hitting those clinically relevant milestones.
And what about quality of life? Did that improve?
They measured that using a standard questionnaire, the DLQI. Both groups actually reported significant improvements in their quality of life scores, which is great to see, likely the effect of treatment and attention.
Sure.
The improvement was slightly greater in the GPSOD group, but the difference between groups wasn't huge there. And importantly, the oral SOD was well tolerated. Any side effects were mild, temporary, and seemed unrelated to the SOD itself. Similar rates in both groups.
Good to know. So what did the researchers ultimately conclude from this second, more controlled study?
Their main conclusion was that oral gliadin-protected SOD appears to be a useful add-on therapy to phototherapy, specifically narrowband UVB for people with vitiligo, and it has good tolerability.
A useful add-on.
Yes.
Yeah.
But, like all good researchers, they also pointed out the study's limitations.
Which were?
Well, it was conducted at just one medical center. As we mentioned, the participants were mostly those with long-standing vitiligo who hadn't responded well before, so the results might not apply to everyone, like those with newly diagnosed vitiligo.
Right, maybe it works differently in earlier stages.
Possibly.
No.
Also, the twice-weekly UVB schedule might have resulted in a generally lower response rate overall compared to the more common 3-times-a-week schedule. Maybe the SOD effect would be different with more intensive UVB.
That's a fair point.
And they also didn't actually measure the levels of SOD in the patient's blood or skin to confirm it was being absorbed and having a biological effect. That would have been ideal.
Yeah.
So they suggested that future research should definitely look at GPSOD in patients with more recent onset vitiligo and maybe explore different doses or treatment durations.
Okay, so we've looked closely at these two studies now, one using a topical SOD catalase gel with UVB, the other using oral gliadin-protected SOD with UVB. If we try and bring it all together, what's the overall picture regarding SOD for vitiligo based on this research?
Well, I think the overall picture is one of cautious optimism, perhaps. Both studies, despite their differences in approach and design, do seem to suggest that SOD, whether topical or oral, might have a role to play alongside standard UVB therapy.
Yep.
The first study, the topical one, showed quite promising repigmentation results, especially on the face and neck, even if it wasn't controlled.
Right.
And the second, more rigorous placebo-controlled study did find that adding oral GPSOD led to a statistically significant improvement in overall repigmentation compared to UVB alone.
But, it's a big but, we have to keep those limitations in mind, don't we?
Absolutely crucial. The lack of a control group in the first study is a major caveat. And in the second study, the specific patient population, those recalcitrant cases, and the twice-weekly UVB schedule mean we can't necessarily generalize the findings widely just yet.
So we shouldn't be telling people to rush out and start taking SOD based solely on these.
Definitely not draw firm conclusions or change practice based only on these. They are encouraging early steps, particularly the oral study because it was controlled. But what they both really underscore is the need for more research specifically, larger, multi-center, placebo-controlled trials.
To really nail down if SOD is effective, for whom, and maybe the best way to use it, topical, oral, what dose, combination with which type of light therapy, all that stuff.
Exactly. We need to solidify these preliminary findings before it can become a standard recommendation.
Okay, so just to summarize our deep dive today for everyone listening, it looks like both applying SOD directly to the skin in that gel with catalase and also taking a specially protected form of SOD by mouth. When you combine them with narrowband UVB light therapy, well, they showed some potential benefits for vitiligo in the studies we discussed.
That's a good summary.
And that oral form, the glide and protected one, designed for better absorption, it did show that statistically significant edge in overall repigmentation in the controlled trial.
Correct. It's important, though, for you to remember that vitiligo is, well, it's a really complex condition. Research is constantly evolving. These studies offer some intriguing possibilities, especially because they target that oxidative stress angle, which we think is quite important in vitiligo.
It really makes you think, doesn't it? If oxidative stress is involved in vitiligo and maybe SOD helps counteract that, could this enzyme or maybe other antioxidants have a wider role in dermatology? For other skin conditions where oxidative stress is also thought to be a factor.
That's a fascinating question.
What kind of future research might head down those paths, looking at these antioxidants maybe in different combinations? It's definitely something for you to mull over, this idea of interconnected pathways and maybe